Brilliant. Thank you, Ellie. Yeah, so I'm Amy. I'm a program officer in the evidence team. And I'm going to take you through the gender and gender identity section of the toolkit. So I'm just going to begin, just to give some background context, I'm going to take you through the definitions of gender, gender identity and biological sex, as sometimes there can be a bit of confusion between these terms. So I thought it would be helpful to go through at the start. So, as described by the World Health Organization, gender refers to socially constructed characteristics associated with men and women, including behaviours, norms, and roles. So, gender identity is described by the World Health Organization, as a person's individual, internal, and deeply felt experience of gender, and it's also about how they present their gender identity. So as shown by the image on the left, gender identity is something that exists as a spectrum. So this spectrum includes the binary genders of man and woman, and also a broad range of non-binary gender identities, which includes, but by is no means limited to, people that identify as non-binary, gender fluid, and genderqueer. Gender identity and gender reassignment are legally protected characteristics under the Equality Act 2010. And it's also worth mentioning that the language surrounding gender identity and gender is something that's continually evolving. So in contrast to this, biological sex is concerned with the physiological and biological characteristics associated with males, females, and intersex persons. So that includes reproductive organs, hormones, and chromosomes. Biological sex also exists as a spectrum, shown by the image on the right. So sex is different and separate from gender identity, but it can interact. So a person's gender identity may or may not correspond to the sex they were designated with at birth or their physiology. And like gender, biological sex is a protected characteristic under the Equality Act. Next slide, please. So this slide contains some census data that illustrates the national and local context. So in the 2021 census, a question was added that looked at gender identity for those that were 16 and over responding to the census. So it asked the question, is your gender identity the same as your sex registered at birth? So responses to this question were voluntary, and citizens could answer yes or no to that question. And if they responded no, they could then self-describe their gender identity using a free text box. So as shown in this table here, we've compared the findings for England and Wales to Birmingham. And this is showed, so if we take the first row in the table, the proportions of citizens in Birmingham who identify as a different gender to their sex registered at birth was nearly 1.4 times greater than the proportion for England and Wales. The second row shows that Birmingham also had nearly double the proportion of citizens who identified as a gender different to their sex registered at birth, that then also didn't disclose their specific gender identity. So compared to England and Wales, the portion of citizens in Birmingham that identified as a trans woman or trans man were 1.5 and 1.6 times greater, respectively. And the proportions of non-binary citizens were similar between England, Wales and Birmingham. And the proportions of citizens identifying as a gender identity, which was grouped under the all other gender identities category, was the same. And then finally, in Birmingham, the proportion of citizens that did not answer this question on gender identity in the census was 1.4 times greater than for England and Wales. Next slide, please. So this slide just gives a couple of examples on health inequalities related to gender. So something we pulled out of our deep dive report on the learning disability population was that we'd found data, national data that showed that females with a learning disability have a greater reduction in life expectancy compared to the general population than males with a learning disability. So this showed that males with a learning disability had a life expectancy of 55.7 years, which is 23 years lower than males in the general population, whereas with females with a learning disability, the life expectancy was 55.6 years, which was 27 years lower than females in the general population. And then the next example is pulled from our trans community health profile, which our communities team put together. So this found that there were lower rates of cervical cancer screening in trans people than women in the general population, and only 58% of eligible trans people had ever undergone cervical screening, compared with 70% of women in the general population. Next slide, please. So here we're just highlighting the importance of collecting gender and gender identity information for a person-centred approach and service improvement. So with a person-centred approach, it's really important to collect this gender information to allow us to provide care and support that is sensitive to the diverse backgrounds and experiences of people, and it also helps us to avoid gender-based assumptions and design interventions that suit the service users' need. And then looking more at service improvement, gender and gender identity information is really important in helping us to understand and then go on to address the health needs and challenges of people with different gender identities. And this in turn allows us to assess and improve the quality and effectiveness of the services for various groups and find out where we need to do better. It also allows us to develop and implement policies and programmes that importantly support health equity and social justice. Next slide, please. So these are the questions that we have relating to gender and gender identity in the toolkit. So the first question asks, what is your gender? And then there are the following options. So they can select male, female, non-binary. And then there's an option for other, which is a free text box. So they can self-describe how their own gender identity in their own words. And then there's also, importantly, an option, do not wish to answer, if they don't wish to share this information. And then secondly, the second question we have is your gender identity, is the gender you identify with the same as your sex registered at birth? So there are the options of yes and no and do not wish to answer. Next slide, please. And then just to finish off, some specific considerations relating to this section of the toolkit. So there may be underreporting with individuals who do not have the same gender identity as their registered sex at birth. So some people who identify as transgender or non-binary may not report their gender identity as they might not be comfortable disclosing it. So one of the ways that this could maybe be mitigated to some extent would be by asking individuals to complete their forms individually. However, this is a bit context specific, and in some situations this might not be possible, but just a potential way of mitigating this. And additionally, some people might not understand the difference between gender identity and sex, and they may use these terms interchangeably or may not be familiar with the concept of gender identity or the diversity of gender expressions. So that's relating to the definitions I went through in the first slide. And this highlights why we've asked the question about whether their gender identity matches their assigned sex at birth, and the whole point of asking these questions more widely and improving education on this. So that's all on the gender identity section. If we go to the next slide, I can